Graston technique is a unique method of instrument-assisted soft tissue mobilization where we use stainless steel instruments to assess and treat soft tissue dysfunction. The instruments are made of a very dense stainless steel, so as the clinician glides the instruments across the tissue, the abnormal tissue texture will actually be amplified through the instruments into the clinician's hands. So the clinicians are still using their hands, they are just using an instrument between their hands and the tissue to again amplify that abnormal tissue texture. So we use the instruments diagnostically to identify areas of restriction or fibrosis or dysfunctional soft tissue. Once we identify those lesions, we can very specifically manipulate that soft tissue with the instruments. It could be uncomfortable, but I would say that Graston technique is actually more comfortable than what is traditionally done with a therapist's hands or fingertips. The treatment edges are very precise, and it allows the clinician to treat this tissue much more specifically than what they typically could do with their own fingertips. So it really is a more comfortable intervention than what is traditionally done manually. Treatment duration really varies by the injury. The longer an injury has been sustained or is there, the longer it will take to recover. So acute injuries typically respond quicker than maybe more chronic injuries. But typically we'll treat patients maybe for about 10 minutes or so with the instruments. Now the technique itself really does incorporate other things other than just the intervention with the instruments. We have patients warm up before they're treated. After the treatment with the instruments, we have our patients exercise. The instrument component, though, like I said, takes about 10 minutes. If we are creating microtrauma or stimulating an inflammatory response, typically we'll treat those patients twice a week. The typical inflammatory stage will last 24 to 48 hours, and we like to have our patients work through that stage before we treat them again. So that typical patient we typically see maybe twice a week or maybe every second or third day. Now we can use Graston technique for other non-inflammatory conditions. So in those cases we can treat patients on a daily basis. Conditions we think about treating are typical soft tissue injuries. So you think about things like golfer's elbow, tennis elbow, Achilles tendonitis, plantar fasciitis, IT band syndrome. But something else I like to point out, typically any orthopedic injury is going to have a soft tissue component to that injury. Now it may be a secondary lesion. For example, think about somebody with arthritis, a condition that mainly affects the joint. Well, you still see soft tissue changes associated with arthritic joints. And so we can treat arthritic joints with Graston technique by addressing the secondary soft tissue lesions in conjunction to what we're doing with the joint. So for the joint itself, we may be doing things like low resistance exercise. But again, for the connective tissue around the joint, treating that connective tissue with Graston technique can help alleviate some pressure on those arthritic joints very successfully.